When it comes to your patient's evaluation, how thorough should a nurse practitioner be? Welcome to the premiere of Where NPs Go Wrong, a series dedicated to examining real-world examples of malpractice or poor practice by nurse practitioners. If you are new to this channel, I am Dr. Patrice Little, and I help nurse practitioner students and new graduates transition competently and confidently into practice by equipping them with the resources to thrive, ensuring they deliver high-quality, equitable care and prioritize patient safety. Let's take a look at a case involving a nurse practitioner at a medical center in Philadelphia. She was named in a malpractice lawsuit for failing to properly treat a patient who had severe hyperthyroidism. On his first visit, blood tests revealed significantly high thyroid hormone levels, indicating the severity of his condition. Despite these alarming results, the necessary adjustments in his treatment were not made, nor was he adequately informed about the gravity of his situation. During a follow-up appointment, his blood work continued to show dangerously high levels. However, there were no changes in his treatment plan, and he was not referred to a specialist. The lack of communication and failure to act on these critical test results were major factors in the deterioration of his health. Months later, he returned to the medical center with persistent symptoms and a still swollen neck. Once again, his blood work indicated severe thyroid levels, but he was not notified, nor were there any changes to his treatment. It was only after he saw a different provider that urgent actions were taken, including increasing his medication dosage and recommending a thyroid ultrasound and endocrinologist visit. Unfortunately, these steps came too late. Shortly after his last visit, he experienced severe symptoms, including nausea, vomiting, and weakness. He was rushed to the hospital, but died upon arrival. The jury awarded his family over $1.4 million in damages, recognizing the gaps in his care. To avoid such tragic outcomes, NPs must ensure 5 key practice habits: thorough patient evaluation, effective communication, timely adjustments, referrals, and follow-ups. Over the next 5 weeks, we will explore these 5 key practices from this case, each essential for improving future patient care. This week, let's take a look at patient evaluations. One may ask, what's the difference between patient evaluations and a physical assessment? A patient evaluation is a comprehensive assessment of a patient's condition, treatment progress, and outcomes over time. It includes ongoing monitoring, re-evaluation of treatment plans based on new information, and making adjustments as necessary to achieve optimal patient outcomes. On the other hand, a physical assessment refers to the initial process of gathering and interpreting information about a patient's condition, which forms the basis for diagnosis and treatment planning. When faced with abnormal lab results, re-evaluating the patient's condition and treatment plan is vital. Thorough evaluations can make all the difference in patient outcomes. Subscribe to this channel to join me next week as we look further into this case, learn from this NP's mistake, and strive for excellence in our practice. Until next time, stay informed, stay prepared, and remember, you practice what you practice.